Hello ladies, and welcome back to our pregnancy and postpartum series. Today we are on episode 15 and we're going to be talking about aquatic exercise. My name is Christie Amundson. I am a physical therapist. Thanks for joining me again this week. I am 34 weeks pregnant this week, and as I've mentioned in many of the other episodes, there are many benefits to exercise in general in pregnancy and the postpartum period, including easing constipation, decreasing your risk for gestational diabetes, preeclampsia or emergency C-section, shorter labor times, decreased swelling, and also promoting a healthy weight gain during pregnancy, and then after pregnancy trying to get back to a healthy weight. However, exercising in the water environment specifically can help relieve joint, spine, and muscle pain and pelvic pressure a lot because of the buoyancy factors in the water. In addition, whether it be in a warm water pool or a cool water pool, there are benefits to each. So warm water can help, the heat can help reduce some of the pressure and help relax your muscles for any muscle pain, joint pain. But a cool water can often help with nausea more. And also if you kind of feel like your sweat glands are on overdrive, can sometimes help to dip in a cool water pool. So as I've mentioned many times in episodes previous, you always want to check with your medical provider before you begin any new exercise program. But once you do that, other precautions that are more specific to aquatic environment is just make sure that because of pregnancy, when you're in pregnancy or the postpartum period, you do have some drastic body changes that will throw off your center of balance. So just be extra careful when you're getting in and out of the pool and on the pool deck that you don't slip or fall. You also want to make sure you stay hydrated. Sometimes when you're in the pool, you don't realize how hard you're working because you can't really tell how much you're sweating. In addition to that, you also, it's for whatever reason, people tend to remember kind of bringing their water bottle into the gym and using that by the cardio machines or the strength machines, but it's more atypical for people to actually bring their water bottles into the pool area, but make sure you don't forget those. Also, in general, it's not recommended during pregnancy that you're using a hot tub. You don't want anything that's going to raise your core body temperature higher than 101 degrees. That's kind of the mark that they have shown with research that it can really have potential health problems for yourself or for your baby. Usually, most hot tubs are set between 100 and 102 degrees, with the max setting to be about 104. So you just want to watch out for that and avoid the hot tub setting. I am very excited because in a minute we are going to show you some various exercises and activities that you can do in the aquatic environment. And whether your goal is to relieve pain, strengthen your muscles, or get a cardiovascular workout, we have you covered. Here at Impact, we have a therapy pool that is a warm water pool. It is set at 92 degrees, so we are nowhere near in danger of that hot tub temperature I was just talking about. But I will tell you a little secret about me. I actually have a skin allergy to chlorine, so I don't actually get to go in very many pools, which makes me extra excited today. Our pool is actually closed today, so we were able to deplete the chlorine levels down low enough that I can pop in there and show you guys some things safely. So I'm very excited. So for that reason, obviously I don't treat patients in the pool. However, I do have a very special guest with me today that has been treating pregnancy and postpartum patients in our pool since it opened in 2003. Her name is Mara Brandsoy. She is an occupational therapist. So I'm going to get changed here and we'll meet you in the pool. All right, so here we are in our aquatic center at Impact, and you might notice that our pool looks a lot different than a traditional kind of a wellness or community pool that you might see. And our pool is very specialized for therapy, which Mara will talk about in a second. But I just have to tell you guys that I don't get to go in very many pools because of my allergies, so this is amazing. I talk about it all the time, but just to feel it when I was coming down the steps and as the water just comes up over your belly, it just literally just lifts the baby weight up, and it is amazing. So you have to try it. But this is Mara Brandsoy Schwager, and she's going to run us through some different exercises for movement, to relieve pain, to help strengthen, and for some cardiovascular options as well. So you can take it away.
I'm Mara, and I think what Christie said when her first comment when she came into the water is probably the number one thing that we hear that pregnant women love as soon as they enter the pool. Our pool is a warm water pool, and it is a prism pool, and we were the first of its kind, and there's only 2 in the world to date. But it is designed, it's a station pool, and it is designed to be a therapy pool. So we don't have a deep end, and we don't do obviously a lot of lap swimming because we just don't have, that isn't really the purpose of this pool. The thing that makes it unique is the jets, the amount of jet systems that we have in this pool, and we use them in order to facilitate or inhibit certain muscle groups in order to treat our patients that we see in here. We see a fair number of pregnant women, and they typically love the pool. So we're gonna run you through a few different things. Each person or each patient will have kind of their own purpose or their own need or want for when they are starting rehab with us, whether it's most of our patients do have pain, obviously, so they're probably their number one concern is to decrease pain. And then talking about strengthening, especially the pelvic floor musculature, as well as potentially getting some cardiovascular activities, even being able to do that without pain while they're pregnant. So one of the first things we're going to look at is just some basic walking. So Christie's going to demonstrate a reciprocal walk or reciprocal gait. So what you notice is that she is walking with her opposite arm, opposite leg. And why we encourage people to walk with a reciprocal gait is so that she will rotate her trunk in order to stabilize and use specifically her obliques. So what I want to just point out is the fact that Christie's staying relatively upright or slightly flexed, but she's not too far, her torso isn't too far in front of her pelvis, but it's also not too far back where she would start to extend. So here's what we don't want you to do. So we want you to stay flex or rounded so that you have more likelihood of being able to find and facilitate your abdominals. So as Christie walks through there, we want to make sure that you are heel striking as well so that you will be able to turn on or utilize your hamstrings as well as your glutes. Again, our focus is hamstrings, glutes, and obliques. All right? Good. Another thing that we'll move on to is retro walking. So if you notice, Christie's gonna still stay slightly rounded or her rib cage down as much as she can. And she's gonna step back and she's gonna shift her weight over onto the leg that she's stepping onto. Keep it on there as she brings her other leg back and again shifts her weight over to the other side. Good. And just make sure to keep that rib cage down, Christie. There you go. So that she's not extending when she steps back. Good. So let's show them what not to do. So go ahead and step back. Notice she's extending, and 2, she's not shifting her weight onto that side that she's stepping on. She's keeping her center of gravity right in the middle. And we'll have her turn forward so that you can kind of see her weight shift through her hips. There you go. Now she's gonna get rib cage down. There you go. And now she's gonna step onto that right leg.
So this is what you want to do,
yeah.
Right?
This is exactly what you want to do. Get your center of gravity over to the right. And now she's going to change and put her center of gravity with her abs on over to the left. Okay, so that's what you want to do.
So more of that side to side motion, right?
Exactly. And hip shifting. Okay, good.
And I will say that sometimes, I think I was just doing it wrong right there. When you go backwards for whatever reason, it's not as intuitive with your arm swing as when you walk forward. So just if you're ever confused about which way your arm should be going, kind of look down at your feet and whatever foot is in front, you want to use the opposite arm. I think I was actually maybe just doing it wrong.
There you go. There you go. So you can see what we want in terms of a hip shift. Okay, so now we're going to show you sidestepping. So Christie's going to face the camera. Again, she's going to keep her rib cage down. She's going to go ahead and take a step, and she's going to shift over onto that side. and then bring her other foot over to join. Notice her center of gravity moves over to that left side and stays there as she brings her right leg to join. There you go, right there, and bring it over. Now what she should be feeling, now she's gonna go back to the right. What she should be feeling as she gets over here is her abdominals are keeping her rib cage down, that she feels her glutes as she stands and weight bears on her right leg and brings her left leg over to touch or to join with her right. So notice, again, that her center of gravity is staying on the leg that she's standing on. Good, go ahead and come back to the left one more time. There you go. And it's usually typically harder for people to shift over onto the left side in comparison to the right. So really make sure that when you are going to your left that you really do feel your glute kick on as you are standing and putting your center of gravity over to the left. So we can show you what we don't want her to do. So as if she steps over and if she kind of flares her ribs or keeps her center of gravity over to that other side. So notice that she's not bringing her torso with her to weight bear on the.
And I can actually feel that in my pubic symphysis
Well, and that's the
area.
other thing that we want to just discuss too. If any of these positions, retro walking or sidestepping, causes any pain in your or separation with your pubic symphysis or pelvic floor pain, you want to make sure to try to adjust your position. So don't take such a big step. 1, 2, make sure your rib cage is down and that your abs are on, or your obliques specifically are on, and try to really kind of push through that, keep that heel down or push through that heel to really make sure that you feel your hamstring and your glutes. That should provide enough stability that you don't, that it won't cause your pelvic floor to shift or move. Does that feel better, Christy?
Yes.
Yeah.
So I'm moving over on top of my foot all the way with my whole body over my left foot before I step together.
Mm-hmm. So notice her center of gravity is over to that left side as she brings her other leg across.
Versus if I just kick my leg out as if I'm almost doing like a leg lift, right?
Mm-hmm.
And then I try to step together and bring my torso with my other leg, and I can actually feel that in my pelvis that doesn't like that.
Yeah. Yeah, so definitely don't do that. Yeah. Okay. So now you could, in doing these activities, if they feel pretty good and you want to make them a little bit harder, certain things that you can do, you can grab if you can grab pool toys, for example, and if you have some foam, or if you have access to foam, you can go in and put them, hang on to them, push down, and you could do any of these activities. Once you start with the reciprocal gait, any of these activities with foam, which will distort Christie's center of gravity and make her work a little harder. So you see her shake a little bit. Now what Christie's doing really well, because she knows what she's doing, is that she's pressing that foam down. Well, when you first give somebody foam, what they typically try to do is elevate their shoulders, just like Christie's doing right there. But what we usually cue that person to do is push down and keep those arms down or scapulas down, shoulder blades down in the water. This will assist in turning on or facilitating, again, your obliques, hamstrings, and glutes. Okay? So there's a variety of different accessories that you can use in the pool. This is probably the most common.
And you can use these with any of them, right?
Absolutely. And with any of those, with that retro gait, with the sidestepping. The other thing some people will use are the gloves with the webbed fingers that will create drag in the water. So you can use that when you're reciprocally walking. You just might have to change your forearm position just a little bit to get a little bit more drag. But there's a bunch of different items that you can kind of add to make it more challenging. Okay, now we're gonna show you a couple different things that we're gonna actually use our parallel bars for. You can, if you have parallel bars, you can do some of these exercises. Otherwise, if you have a deep water, I'll show you how you can kind of modify this to do to work in the deep water portion of the pool that you go to. So the first thing we're going to do is Christie's going to go ahead and just come down on the parallel bars on her elbows, and she's going to bring her feet forward in front of her, And she's gonna basically, you can bend your knees a little bit. She's basically gonna hang here. She's gonna go ahead and slightly retract or pinch those shoulder blades a little bit so she starts to feel her, the muscles right through here or her low traps in combination with her obliques. Okay, so she's just gonna keep kind of pushing down through those elbows. And she can actually just kind of hang right here if it feels pretty good. So how does that feel, Christy?
Good.
Okay, so just try to kind of push through those forearms. There you go. So you want to make sure that your shoulders aren't coming up towards your ears like that. We want to make sure she's pushing through those forearms to make sure that you get your low traps or your scapular stabilizers on. So what she's basically doing right now is providing a little bit of traction through her spine as she's kind of hanging here. Now, if you were actually in the deep water, what you could do is put a noodle around around your upper back and bring it right around, encircle it around you, and you can just go ahead and hang. Now, what you're going to do is you won't be quite as flexed as Christy is right here, but what you can, if you're in the deep end, you can go ahead and bring your knees just a little in front of you. We want to reduce that arch because obviously when you're pregnant, as that baby grows, it pushes you more and more into an extended state or too much of an arch of your low back. So any way that we can get you out of that position in a comfortable way, we want to make sure to do that. So again, if you're in the deep end, you can go ahead and hang on to that noodle and just let yourself hang. You're going to keep your feet slightly in front of you like Christy is right now. And she's going to keep pushing through her low trap. So even just holding this position, she's using low trap and obliques, and those are especially important to provide additional support through your upper thoracic essentially or your mid back in order to reduce that forward shoulder posturing and forward head posturing that occurs as essentially the baby grows and you get extended. Okay, so what I'm going to show her now, so that's kind of it's a strengthening, but it also could be used as a relief position. Go ahead and push through those arms again. Okay, go ahead and bring your knees up. I'm going to have her go ahead and bicycle a little bit. There's a bunch of different things that you can do with your legs to make this activity more challenging. So Christy could actually bicycle while she's pushing down into her forearm. She could actually go ahead and reverse and go and bicycle backwards, which is a lot harder for people. Go ahead and push through those forearms. You see how she's starting to drop down because she's got too challenging activity going on. The other thing is you get stronger and you're able to hold this position. So go ahead and again push through those forearms. She can put her legs out straight and she can just kind of hold this, we always call this kind of a half plank position, if you will. And she can actually take and scissor her legs, but you want to be careful about the distance that you're going out in case you do have lower pelvic pain or pubic symphysis instability. So she's just alternating her legs and kind of scissoring in the water as she's pushing down through her forearms. And again, you can do this in the deep end if you're hanging on to that noodle around you. You can go ahead and do some of this scissoring, but you're gonna wanna, go ahead and rest. You're gonna wanna keep your feet basically in front of you, okay, or slightly in front of you. So the thing you want to avoid is if I'm hanging in a deep end of a pool, is I want to make sure that, here I'm going to come right in here so Christy doesn't have to demonstrate this. But you want to make sure that when you're hanging in that deep end and you're doing some of the bicycling, you want to make sure that you keep yourself slightly flexed. What I do not want is someone bicycling back here, because you notice how I'm arching my back. So you want to really make sure your rib cage stays down and your abs stay on as you're doing any of these exercises. So again, you can kind of make this as challenging or not challenging as you want. So if you're just going in the position and you just kind of want to hang out and provide yourself a little bit of traction, that's fine. If you want to go ahead and do a lot more leg movement, you can actually turn these positions into more of a strengthening. And if you increase the movement of your legs, especially in the deep water, you can turn it into a strengthening and cardiovascular activity. Do you have any questions?
No, I'm actually surprised how much I can feel my abdominals with this.
Yep.
And I know, we've talked a lot in previous episodes about your abdominals being overstretched. And this is like a gentle way, but I can really feel them working. So it's a nice change.
Okay, we're gonna show you another position or activity. Again, you can vary this to assist with pain management, for strengthening, and even a little, not as much cardio, probably more strengthening, unless you're really doing a lot of movement, because you're basically gonna just be holding this squatting position. So what Christie's gonna do is she's got her kind of natural waistline against the wall. Her feet are forward. I actually have her placed on a 4-inch block currently, so that if we do decide to do a little bit more movement-based activity, that she has a little bit more of an advantage or ability to kind of squat down and up, and that way she's not getting she's not too far down into the water and drinking the water, basically. So she's going to keep her feet forward. She's going to go ahead and bend her knees. She's going to keep her heels down. Good. And you're going to go ahead and squat as low as you can comfortably. Good. And as she's pushing through her heels, so you never want to go forward on your toes. You never want to lift your heels up, because we want to make sure that you are also feeling hamstrings when you're in this squat position. So yes, you'll feel a little bit of quads, but again, we want to make sure that you're integrating or using hamstrings while you're in this squatting position. So Christy right now is pushing through her heels as her knees went slightly forward and her back is flat against the wall. Okay, so she's slightly flexed. So one thing she could do here is she could just stay here and just breathe, basically, if this was challenging for her. So she would just try to keep herself down in the water as she inhales and exhales. Good. And what she'll feel is she'll feel a lot of expansion on inhalation with her with her back. That'll expand more so. So a couple things that she could do to make this more challenging is we could go ahead and give her some foam, and let's make it a little harder. We'll give her 2 of them. And she's gonna go ahead and just press that down, bend her elbows just a little bit while she's in that squat. So you wanna make sure that as you're doing that, that you're keeping your shoulders down, that foam doesn't cause you to elevate those shoulders and turn on those upper traps. So you can go ahead and widen out your hands a little bit more. Now, one thing that she could do, again, to make this more challenging is go ahead and bend your elbows just a little bit. She can go ahead and go up and down with the foam. She can get a little bit of tricep, low trap, a little bit of tricep, and again, she's working abs, hamstrings, a little bit of quads, of course, too, and triceps, low traps. Good. Okay, if we want to make this a little bit more challenging, we can go ahead and give her the foam on both sides, and she can go ahead and do an actual partial squat down in the water, and good, and then come back up, and down in the water, and come back up. Now you can actually take foam and use larger items. This is a small delta bell, and we actually have larger ones too that make this positioning or this activity a lot more challenging. Okay, another thing that you could do in this position is if you've got, again, depending on what you have for accessibility at your pool, these little helmety things are called Aqualogics, and there's a couple different sizes. And what these do is they create drag in the water, which then creates resistance. So what Christy can actually do right now is as she's squatting, she actually can do a little bit of upper extremity movement or kind of punching, if you will. And you can feel the resistance in the water, right, Christy?
Yeah, it turns on my abs.
Yep. And she should also keep pushing through those heels. So whenever you're doing any of these activities in this partial squat position, you have to make sure that your heels are firmly placed, in this case on the block. Okay, she can go ahead and put those down at her side and do a little bit of flexion and extension. There you go. Again, there's a bunch of things that you could do movement-wise with these items. Does that feel kind of challenging? So again, this is a little bit more strengthening. You're not going to get much cardiovascular work here, but unless you sit there and kind of do a little bit of some squatting with a little bit of movement, but it's a little bit more challenging to get your heart rate up in this position. But it is a good position in terms of strengthening obliques, and in this case with adding a little bit of upper extremity strengthening with your core on, if you will. All right, so we're gonna go over a couple of things to really pay attention to while you're in this position. One, Christy's back is firmly planted against that wall, and she's tucking her butt or hips kind of underneath her. So she's slightly flexed and she's keeping her heels down while she's squatting. What she is not doing is she's not leaning forward while she's moving her arms. She's keeping herself back against the wall. What she's also not doing is she's not extending her spine. There you go, as she's doing the movement with her arms. Okay, so again, what she's gonna do is she's gonna keep her back natural waistline against the wall, keeping her hips kind of tucked underneath her with her heels down, and basically her shoulders down as well. Notice she's not elevating her shoulders with any of these movements that she's doing with her arms, okay? One other thing, if you have, you can stop, Christy. If you, in your pool, if you have the ability where there's to get in front of a jet system, so that Christy, if we had our jets turned on right now, what I would have her do is I'd have her squat right in front of a jet, so she can actually get a little bit of a massage with her mid-back and potentially low back and get into a little bit more of a relief position if that's possible for you to do at the pool that you're working in. So again, look for jet systems that you could go ahead and squat right in front of and direct that jet to give you some significant massage and relief through your mid-back and low back. All right, we're just going to show you a couple more things. First, we're going to show Christy in kind of a relief position, or a position that should feel really good. So depending on, again, what you have available, what sort of pool equipment you have available, we've kind of modified this Aqualogic jogger that's up a little higher on Christy, and then she's got this paddle, or kickboard, excuse me, right on her chest. So she's going to go ahead and just kind of let herself float in the water and bring her legs up slightly. And then what I would actually have her do, if I had a noodle right here now, I'd just throw a noodle right behind her knees, and then she could just go ahead, see her kind of relax and float. So you could also put a couple noodles around, like where this jogger, this blue jogger is behind her. You could put a couple of noodles around there and just allow yourself to kind of float. Isn't that comfortable?
It is.
Yeah.
Feels good.
Okay,
Very
so
relaxing.
Okay, so and then for the people that are real big lap swimmers, one of the things we want to kind of talk to you about are the different types of strokes or swimming strokes. The swim strokes that we would like you to avoid is anything when you're prone on the water or when your stomach is facing towards the bottom of the pool floor. So like the breaststroke and the crawl, we'd like you to avoid while you're pregnant because it really is difficult to not go into an extended position through your spine. So instead what we'd rather have you do would be side stroking. And please make sure that when you are doing a side stroke that you do or complete both sides, because one of your sides will probably be easier for you. And so make sure that you're going back and forth between both sides. The other thing that you are welcome to utilize is the backstroke. So some people will go ahead and go into the traditional backstroke, but you can actually modify it. And Christy's going to demonstrate that to us, where essentially she's grabbing onto a kickboard and just kicking her way through the water. Good. And she can go ahead and then turn herself around and go back the other direction. So that's just a modification. You could use a noodle, depending, again, what sort of pool equipment you have available. But basically, we don't want you with your stomach down on the water. We'd rather have your stomach up or supine to make sure that you're in more of a flex state versus extended. So hopefully that's helpful for people that are really wanting to get back to lap swimming and lap swimming safely and comfortably without increasing any of your pain if you are dealing with pain.
Thanks for joining us on our Impact Your Life channel in our pregnancy series. I hope that you found some things helpful for this video that will help you out through the remainder of your pregnancy and the postpartum period. Please, if you did, like this video and be sure to subscribe and hit that bell icon to get notified of our future episodes. And we will see you next week. Take care.